Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Speckle report. This audio podcast is part of a Heighe Bedlam. This audio podcast is part of a Bedlam Plexar. This audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around sort of a some discussion points, if you like, as part of this peer-reviewed and published works from 2021, 2022. So healthcare service users can find the education they receive about sort of illnesses sort of confusing, and they may prefer to be seen by a clinician or a general practitioner to discuss sort of healthcare. However, they will also be referred to several allied health professionals throughout disease trajectory. Online spaces like that of the RPSG could be supplemented for healthcare service users to make them to help them make decisions and provide sort of centric care and education. At present, there is an overall lack of educational support, especially in later stages of the disease of the illness or the disease to help CKD healthcare service users. Existing sort of non-clinical personal. So, for example, clinical and biomedical laboratory specialists will require or should require sort of training and reallocation to work with healthcare service users if there is a way for them to become more intricately involved in healthcare. Evidence indicates that a proportion of CKD healthcare service users access online online healthcare records intermittently, but over extended durations. The patterns and timing of patients' use indicate that healthcare service users have an intrigue in detailed information such as appointments, telemedicine, and clinical letters. However, this does not mean that healthcare service users know at the same time what tests and investigations really mean when they are available on electronic patient records. Thus, health literacy is still an issue for healthcare service users. Patients or healthcare service users can sorry are also all to identify support in online and through support groups, web portals, and smartphone apps. Health literacy can be a barrier to decent care. One mixed one investigation one investigation from around 2017 informed that online portals are not designed to present tests or investigations to healthcare service users in an intuitive or accessible way. That draws this audio podcast to a close. This audio podcast as part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar. This audio podcast as part of a Storm Robotics production.